Good afternoon, Yorktown. It's Supervisor Matt Slater coming to you from Town Hall. I'm joined with some special guests today. One of the things that we've heard quite a bit from, especially our seniors and the elderly of our community, is trouble signing up to get your appointment for your COVID-19 vaccination. And so teaming up with Noreen O'Driscoll, who is the director of our Senior Services Office, and Lisa Epstein, who is a school nurse here in the Yorktown Central School District, we wanted to provide you with some tips and some steps to make sure that you know when and how to sign up to receive the COVID-19 vaccine. As a reminder, the town of Yorktown is a low man on the totem pole when it comes to the vaccine. It is predicated off of the supply, and we are doing everything we can to connect as many people as we can to providers to make sure that they do get the vaccination as it becomes more readily available. This past weekend, Johnson & Johnson was approved by the FDA, which was great news because they've already shipped 4 million vaccines nationwide, so that vaccine supply continues to grow. We have heard in the past from our partners on the state level that the supply, meaning the number of vaccines that are being allocated throughout New York State, is far less than those who are eligible. So at one point we had 10 million, I think this is about a week ago, we had 10 million New Yorkers eligible, but we were only receiving about 300,000 vaccines for the week. So we understand the frustrations, we share them, but we also are doing everything we can. And I really want to thank Noreen and Lisa because they've been great partners in the community, helping so many receive appointments for the vaccine when they become available. We do not get tipped off from anyone when those appointments become available. We understand the frustration of people who don't know when to look or how to look. So that's what we want to do today, is to try to provide some tips and suggestions to help as many people as we can. Noreen, did you want to provide any opening remarks?
Just like you said, Matt, that we are trying our best. We have no more information than the average citizen. Just it's persistence, and once you find it, you run with it and put your own information in before you try and call your friends to let them know.
Yeah.
You might lose that appointment.
Well, I really want to thank Noreen because Noreen's been just an absolute gladiator for our seniors. And that's something that we've heard a lot about is our seniors who either don't have the capability or don't know how to utilize a smartphone or a computer. And again, like I said, they may not even have a smartphone or a computer to sign themselves up. And Noreen and her entire office have been tirelessly working with our seniors in Yorktown to get them signed up. I think yesterday, Noreen, how many did we get signed up yesterday?
We got about, I want to say 35 to 40 signed up yesterday.
Yeah, so that's a
seniors.
Big day.
That was a really good day, and I'm looking forward to the day when we can just do that, when a senior can call in and that we can just put their information right in and print out their sheet and have a driver drop it off to their house for them. Yeah, that was a good day.
Good. But that's not every day. We know that.
That's right. That's right. Well, I'm looking forward to those days coming that it will be. So
yes. But again, thank you on behalf of the town. You've been tremendous. And I want to bring in Lisa Epstein, who's over at one of our local schools here in Yorktown. Lisa, I know that you've been working specifically with our teachers to help our teachers and the faculty and staff get vaccinated. If you could tell us what you're seeing on your end, that'd be great.
Yep. So, like Noreen said, you have to be persistent and you have to be ready to click the buttons when you're registering. So what we've been having people do is they've been pressing the link, and we tell them that when you get onto the link and onto the site, you just have to keep refreshing. And hopefully, Noreen and I and Matt will tell you how to do that. But some of the tidbits we've learned is that every 3 hours, the sites can get updated. That's what we were seeing. So you have to just, you don't have to stay on for 3 hours at a time, but you have to just keep on going in and checking. And we do know this, that in the morning they get reloaded and in the evening hours, but we'll talk more about that.
Right. So persistence is key. And there's no trick, there's no secret code. There's none of that. I recognize, and I think we all do, It reminds me of getting tickets for, U2 or Bruce Springsteen when you go on, Ticketmaster, and how did all the spots get filled up in 30 seconds? Well, here in Yorktown, Acme, at one point about 6 weeks ago, Acme had about 200 slots opened up. We put it out there, and whenever we find out that there are slots that are open, we do broadcast that. But we put it out there. They had all 200 slots gone in 10 minutes. That's how fast they go. But persistence is key because there are more slots opening up. I really want to thank our partners on the county level because there are more slots opening up at the county, at the Westchester Community College. We saw slots open up there. We've seen more slots open up at the county center, which is a state-run site. That is not a county-run site. That is a state-run site. And working with the county, we are trying our best to bring pop-up clinics up to Yorktown, as well as hopefully establish a regional clinic. I've been working and partnering with our town clerk, Diana Quast, on those two initiatives, and I'm very hopeful that we're going to have some positive news to share in the not-too-distant future. But in the meantime, I do want to go through this tutorial, and I want to bring up, we do have a slide deck from the Westchester County Department of Health that we will share, and we will walk through this together. Just making sure that it comes up here. Okay. So again, this is, I do want to thank our partners at the County Executive Latimer, who's been a tremendous advocate for us as well. And this is a slide deck provided by them. And so we have some key pointers here. And again, this is all information that is really critically important. So the New York State hotline hours of operation is listed as 24/7. Their schedule is 7 a.m. to 10 p.m., 7 days a week. And so if you do not have a computer, especially our seniors and our elderly, you can call to get assistance for vaccination registration through the state. The number is right here on the screen, 1-833-697-4829. It is important to note that the wait time can be lengthy, but that is a alternative for those who may not be computer literate or have a smartphone or a computer. As always, you can also call us here at Town Hall, and Noreen has been just tremendous in connecting our seniors with this service as well. The link to register online is right here. This is the I am eligible COVID-19.health.ny.gov. Also important to note, all these links are right on the town's website. They've been on the COVID-19 impact dashboard since they came out. And so if you need to, I encourage you to please utilize that community impact dashboard because it has a wealth of information, including statistics as to where we are, including how many vaccinations have been given throughout the town that we've been notified of by the Department of Health. So we try to provide that information as transparently and accurately as we can. Noreen and Lisa, anything you want to add before we move on?
Not yet.
And if you forget, where to find it on the website with town, if you just type in your browser, "Am I eligible COVID-19?" it will pop up anywhere. So just so you know.
Perfect. And the other thing I wanted to mention on the bottom, we're going to get into this, but there is a alert system for the vaccine, and that's provided by the county. And there's a SurveyMonkey link on the bottom. Again, this is also accessible through the town's website. And I just really quickly want to, let's see, what did you need me to do here? Okay, that's probably better for everybody. Awesome. Thank you to our staff. Okay, so moving on. I may have. I did. I skipped a few.
Yeah.
Okay, so here we go. Online registration for the vaccine. As we said, and Lisa and Noreen, please feel free to jump in at any point in time here. Here's the link.
What I want to tell them too, the best thing to do is to go on a computer. Don't use your cell phone, because sometimes it doesn't let you click certain links on when you're doing the form.
Perfect. And as you see, when you click on the link, this is the site that it brings you to see if you may be eligible to receive the COVID-19 vaccine.
So Matt, can I just
jump in.
You see where it says no appointments available currently?
Yep.
Don't let that discourage you. Please just continue on once you see that, that's when you have to continue on, because that's how they become available.
Great.
When you keep clicking the refresh button.
So keep clicking. So your tip, Noreen, is for those at home is to continue to click the refresh button, even if they see no appointments available.
Right. Don't be discouraged when it says on this, when you get to this page and you'll see no appointments available currently, you don't leave the page thinking there's no appointments, because there still might be appointments when you click the refresh button.
Great. Again, that persistence, right? Persistence is key. Again, these are just some of this, and again, it shows you coming soon and so on and so forth. And you can see up there, Westchester County Center. Again, this is just a screenshot. This isn't live, so it is at this point. It did say no appointments available, but to Noreen and Lisa's point, continue just to hit refresh.
Right. Once you hit get started, even though it says no appointments available, once you hit get started, there might be appointments available on there.
So you click get started, and this brings you to the next page.
Right.
Great. You want to walk us through it?
Yeah. So I'll jump in on here. So just so you know, when it says date of birth, you have to have 2 digits for your first month, 2 digits for the date, and then 4 digits for your year. You do not have to put in the little slash marks. In fact, it's better if you don't. So just put in, like on this person, 09/11/1933. Just put in just like that. And then you just pick your sex. You put down, do you work in the state of New York? And say yes. Do you live, if you don't work because you're retired, you hit no. If you live in the state of New York, of course, we say yes, and you put your zip code. And just so you know, if you're 65 and older, only placing your date of birth will bring you to the next screen where you can sign up. You don't have to go through a lot of questions, because once it says that you're 65 and older, it'll take you to the new screen. Right, Noreen?
Right.
Great. So this is also, you can see in the acknowledgement part here, you do have to check that box, I believe. Is that correct?
Yep.
Yes, you do.
The consent box, and then you would hit submit.
Oh, and if you do have a comorbidity, as long as you're 65 and plus, just go by the date and, put that in.
Perfect. Okay. So you're going to put that in. It brings you to this page, which obviously thanks you for providing that information. And then you would click locate providers. Just making sure that it times right. Locate providers. You want to walk us through this screen?
Sure. So then you find which place you would like to go to, which center you would like to go to, and hit schedule your vaccine appointment. Once you hit to schedule your vaccine appointment, it will take you to the next screen of available appointments or.
So this is that screen?
Yep.
Yes, to schedule your vaccine appointment. You would click schedule your vaccine appointment, and then the next page.
And these are just other things, other sites, the Aqueduct Racetrack, the Jones Beach. But then if you clicked on the county center link, this would be the next page.
That's correct. So that's what it will look like if there's an appointment available. And you want to click that select visit time as soon as you can, as fast as possible. Right, Lisa?
Yes. And you'll see that halfway down it says appointments available. So in this case, it says 1. And what we were noting, and I'm sure is that if you had just one appointment available, by the time you hit select visit time, it would be gone. So perhaps look for a date where there are multiple appointments, like maybe 10 or 20. That's what you do. And then you select the visit time, and you'll have a better chance of getting a spot right away.
Great.
So let's see if you can hit select visit time. What would it say?
Let's see. So this is when it's full, because it says appointments available. So these are just some pointers for our elderly or frail that require assistance at the county center. As you can see, the waiting lines do and will wrap around the block. The senior must plan to arrive with an escort. Hospitals provide wheelchairs. There's important to note, if you are going to the county center, which is the largest hub right now, there is no parking in front of the county center. They do allow you to use the parking lot across the street. There are county police officers that are stationed there that will direct you to where you need to go. If you do go with an escort, the escort should come to the handicap accessible ramp to ring the buzzer. They can collect a wheelchair and take the patient into the county center. The escort is expected. Yes.
I would just like to add that seniors should not be discouraged if they need a wheelchair or help. I have had to drive some seniors down there, and when you get there, you can pull up to the front where the wonderful National Guard is waiting for you,
Yep.
and they will help that senior and push that senior in through the handicap ramp while the person who drives you parks their vehicle.
That's great.
And I think there's a point on there when they're signing up, if we go through that again afterwards, that they have to put down if they do need help. So it says, do you require assistance? And they say yes, and then they'll know.
Great. As a reminder, some of our pharmacies, they are also providing appointments, and those pharmacies are specifically for 65 plus eligible residents. We do provide the list on the town's website, and we have heard, and Noreen, I think you can speak to this directly. We have heard of a number of seniors who have been very successful in utilizing some of the local pharmacies and getting their appointments. Yes,
I heard the one in Croton had 500 appointments yesterday from their wait list.
I think it was Save More, right? A Save More pharmacy.
Yes.
So again, we continue to provide this information right on the town's website. Just some more information if you're using the online scheduling option. After you've selected an available date and time to complete the registration in its entirety, you'll need to provide an emergency contact. You have to answer medical screening questions that will require your consent to continue with the registration. And it's important, of course, to review all your entries for accuracy before submitting the registration. Your confirmation ticket will be available to print, and you should receive either a text or email, depending on your preference on how to be contacted in the registration. You want to talk about the COVID-19 form, Lisa?
Sure. So, and I'm hoping to maybe, Matt, we could go through like a live simulation, just showing, and we could put any kind of date of birth to show them, because some things aren't answered on here. So once you have completed your registration and you have your appointment site, there's a New York State COVID-19 form. And all that is it's affirming that, yes, you are 65 plus. And if you did happen to put in a comorbidity, like if you have heart disease or cancer or asthma, is affirming that everything there is correct. And then you just hit accept, and then you will, it'll give you an email to send the COVID-19 on your phone, or you can print it. I don't know, though, for seniors that don't have emails, what would they do? Is there something, Noreen, is there an email that they can use somewhere?
I have been using my email for those people, my work email for those people that need assistance.
Okay.
Any seniors that need assistance like that live in the town of Yorktown.
Okay. So that's
We're willing to help.
Yep.
Yep.
All right, that's great.
And you know what I'm thinking, Noreen, also, I'm wondering if we should have copies of the form made available at Town Hall in case a senior needs to come in and get a hard copy of the form, so this way they have it. So that's something that we'll provide as well.
And this is the form, so you could either just, for everybody 65 and older, you just go by that. I would say that's my best thing. So that'll get you through the system quicker. And in the bottom, it just will do a little consent.
And these are all the different qualifications. And then here's on the bottom part, you put in your information.
Yep.
And you continue to fill out the questions that they have there.
Now you see all those questions that are there. If they just go by their age, none of those other questions will pop up.
And that's great. That's a great point.
So just don't put anything other than your age.
Again, only if you're not 65 plus. If you are 65 plus, you wouldn't have to answer these, but if you are not 65 plus, and these are the qualifying questions that you would have to answer, you then hit submit. And here is your receipt for completing the COVID-19 vaccine form. And again, you have to have a copy of this when you go. This is for the alert system. So if you are 65 to 75 or eligible under another category, as in phase 1 or phase B, so this is again provided by the County Department of Health, you can sign up for their alert system. Again, this link is found directly on the town's COVID-19 impact dashboard. And I do want to reemphasize, very important, you're signing up for an alert. You're not signing up for an appointment. I just want to make sure we're very crystal clear on this, because this is going to say you're going to get an alert saying you can go sign up for your appointment, but this is not that process. This is just for the alert. Anything, Lisa or Noreen, you want to add on this part?
No. So once they get the alert, they should go to the Am I Eligible site,
Yes.
click on that, and start the whole process.
Correct.
Yep.
Again, this is, referring back to the COVID-19 vaccine alert system provided by the county. And this shows you how to sign up. Again, just putting in that qualifying information, your contact information, phone number, email address. If you are eligible according to phase 1A, if you're eligible according to phase 1B, and again, if you're eligible from phase 1A, you won't have to answer all these additional questions. Always, if you can, rely on that age category that's 65 plus.
And that's phase 1B.
Again, just more on that alert system. So some couple of things to know. Make sure, as always, you speak with your medical provider about the following. All questions are part of the registration form. If you're pregnant, if you've contracted the COVID-19 virus within the last 90 days, it's important to note that if you did, your appointment is to be scheduled 90 days. That's 3 months after contracting the virus. If you were vaccinated within the last 2 weeks, if you had any allergic reactions to any previous vaccines, it's very important to know. We had Dr. Cole on, Lou Cole from Caramount, talking about that a number of weeks ago. If you have autoimmune illnesses or if you're taking medications that might affect your immune system, and if you select yes to any of the above, there's still an option to continue with the appointment, but of course, always make sure that you're your medical provider. So this is scheduling your second dose. You do not schedule it directly online. You get your vaccination card. Lisa, you've had your second dose, right?
Yes.
So do you want to walk through what that second dose process was like?
Yep. So basically, when you have your first dose, that you're going to get your second dose. If it's Pfizer, it's going to be 3 weeks later. If it's Moderna, it's going to be 4 weeks later. And it's the same day and time is what I'm thinking that the sites will schedule you for. So just make sure you keep that vaccination card and date. What I would recommend is you take a picture of it with your phone if you have a phone, so you always have it handy. If you do get a Pfizer or you get a Moderna, both of those shots are not interchangeable. You have to have the same one as the second dose, just so you know that. And again, the site will already tell you that you come back 4 weeks later if you had Moderna or 3 weeks later if you had Pfizer. And the date should be on the card. They'll put it on the card for you.
Lisa, can I ask you a question? So I have some seniors that say, I'm afraid to get the vaccination because I've heard that after my second shot, I'm going to be sick. What would you say to them, seniors, Lisa?
Seniors. Well, I would say to them that by getting the shot, they might get sick a little bit after it. That means that their body is responding to the RNA that was put in there. And it's good to have a little bit of response. That means your body's going to fight it if you get COVID, and then you're not going to get, we're not supposed to be getting as bad as symptoms if you did get COVID. So the vaccine is preventing you from having terrible symptoms if you were to contract COVID.
Right.
Right?
Thank you.
Yep.
So a couple of things to bring to your appointment. Noreen and Lisa, I don't know if you want to add to this. Obviously, your ID and your appointment confirmation printout.
Yep.
So what I've been told, Matt, is you need to bring your medical card as well if you have that. They will be asking for that. It's okay if you don't have it, if you don't have coverage, but you do need to bring it if you do have coverage.
It's like your insurance card, right?
Right.
That's correct.
And also your driver's license or a passport, something that shows that your age, right? Your date of birth, I think.
Yeah, that'd be there. Yeah, bring your ID. Yes, correct. Yep. So a couple things to remember. There's a 15-minute monitoring period on site after administering the vaccine. Again, that's just to make sure that you're feeling okay and that there's no adverse side effects. If you have a history of reactions to a vaccine, you'll be monitored for 30 minutes. This is something that we've really tried to emphasize, very important. There are no walk-ins. You need to have an appointment. So you can't just show up to whether it's the county center or one of our local pharmacies or any of the providers. There has to be an appointment made. And so that's just something that we actually really want to emphasize. And of course, when you are going to get your vaccine, please continue to wear your mask and wash your hands and follow all the guidelines that make sure that we stop the spread of COVID. Now, I know that we wanted to go, Lisa, to do a live sign up.
Yep.
So why don't we, let's see if I can do this now. Let me go over here real quick. Okay. I'm going to share my screen again and you guys can just walk me right through. So I'm going to take this from the Town of Yorktown website. Okay. So if you, again, this is our website. Here is the COVID. It's right here on the front page. You click right on to the coronavirus updates. Okay. And again, this gives you as much information as we possibly can for all the information that we get. So right here, vaccine information, am I eligible website? Okay. And as you can see, this is as of today. So Javits, Jones Beach, you can see, no appointments. There's appointments up in Potsdam we've heard of, Plattsburgh, SUNY Polytech.
I think Yonkers is opening soon. Right now, the ones with the double stars, they're restricted by residency.
Correct.
But I think they said that after the first week or two with their own residents, then they're going to open it up.
That's great.
Oh, that is great.
Yeah.
So we're going to click Get Started.
All right. So you want to just put 2/14/1935.
02/14/1945.
Or 35.
35, excuse me. Okay. Great. Do you live in New York State? Yes. Do you work in New York State? We'll say no. And we'll say 10598.
Yep. And now you have to go to acknowledgement.
Correct. And you're going to click this I consent button down here.
Yep.
Okay. And then you're going to click submit once it lights up. And then that's this page again.
Now you locate providers.
Great.
And you'll see the zip code stays in there. You don't have to re-enter the zip code.
Mm-hmm.
Which is good. And do you want to just try a Potsdam one? Because I know they always have appointments open.
Sure. Let me go down to Potsdam. Here we go. We'll use this one. Appointments available, right?
Yep.
So we're going to schedule vaccine appointment. Okay. You want to walk us through?
All right. So you notice that it says 5 available. Sometimes I skim down a little bit just to see if there's more. So this one's on March 25th. If you are going, and I think, Noreen, you can say the same thing too, I recommend that you take a later evening, later day in the week appointment if you might have a little bit of reaction to the vaccine, because although I guess most people are retired, so it doesn't matter. But for the people like us that are still working, we were taking it Thursday or Friday. So you want to see what the date is to see when you can get there. So this one's March 25th. And what did it say? Appointments till 5. All right, so let's scroll down just a little bit first so they can see that there's other appointments available on other days too. If you scroll down. Keep going.
March 31st. You
There's
have
only one, so that's not going to keep going down.
So then you have 3 on April 1st.
Yeah.
So you have 9 on April 2nd. And again, I just want to highlight so everyone can see here. So here's the date. And then below that's the time. Making sure it's highlighted there. Below that's the date, the registration deadline, which is the same thing. And then how many appointments are available. So you can see here, April 2nd from 8 a.m. to 6:30, you have 9 appointments available.
So let's try that one. Let's click on that one because I'm thinking that they won't get taken up as we see it.
You want to click on this one?
Yep.
Okay, so we're going to come down here. And we're going to click right down here, select visit time, right? That purple button. So we select here, okay?
All right. And then you're going to see a whole bunch of times. Sometimes what happened is if you click on 8, let's try 8:15. Select the time.
Okay.
And then next. Oh, bingo, you're in. All right, so that's pretty good. So now here you would have to put in your first, your last name, your address. Some people say that it's good that maybe on your computer browser, if you ask your grandchildren, your children, to already have your dates and addresses set so that all you have to do is just click on it when you're in the screen rather than typing it all in again. That's an idea to save some time. But here, so you want to just put, I don't know, do you want to put a fictitious? We don't have to do the final, yes. Yeah, there you go.
Okay.
And you have to put a phone number.
So we'll just do, okay.
And you have to confirm it. And is it a mobile phone?
It is not a mobile phone, so we wouldn't do that. But we'll confirm it again.
You want to show me where that is? Because I don't know where it is.
What was the date of birth that you said?
It was 35. Was it
02/14.
1935?
Yep. Okay.
And you don't have to do gender, and you do not have to do the mother's maiden name or first name. It's all optional. I would say don't do it, right, Noreen? So just get right to the slot.
Yeah, exactly. When
So
you
go to
start
next.
taking time to fill that in, you might lose your spot.
Yes, don't do anything that says optional.
Okay.
You
And
do
then
have to do the race and ethnicity, although it doesn't say.
Yeah, I think that we would
You
have
put no
to.
response, or you could put whatever. Yeah.
Oh, you put no response, right?
Yeah.
Okay.
All right. So now here's where we were talking about what method of transportation and if you need handicap access. I don't know, Noreen, how did you have to fill some of this out with some of the people?
I did. So when you click on that, so if you're having someone drive you, you put personally owned vehicle. And then when you click on this handicap, it will say yes or no. So you say yes, and then you specify. So if you need a wheelchair, you put a wheelchair. I had one woman yesterday who said, I can get there, but I can't stand. So I had to put trouble standing, which then leads her to getting assistance once she gets there.
Okay. So then, yes, you need. This is language assistance.
No language assistance, no.
Okay.
And everyone, just so you know that once you're right on here, you're pretty much guaranteed your appointment. I found, I don't know if you found that, Noreen, like once you've gotten all this filled in, then you've got your spot. So keep going.
Okay.
Now you don't have to do any of the emergency contact information because it's all optional. So you can get to your screening. Yeah.
Okay. Insurance information.
So I don't know, Noreen, like what I found with doing this with some people, I just put down that they didn't have insurance. And when they get to the site, they give them their insurance card. It's just easier that way.
Right. That's exactly what I do because I don't have the time to take everybody's insurance information. So.
And you have to do group ID. You have to do numbers. So it's just better just say no insurance.
Right.
So are you checking this box that you were uninsured? Or are you coming down,
Yep.
or do you go below that?
No. I think you have to check the box,
You
Matt.
check the box, but they can still show their insurance card when they
But
get
once you get there, they ask you that again.
it. Okay.
And then you take the information.
Okay. Then you have to.
So now you could either read the privacy information by clicking here
Yep.
and you
right
acknowledge
here.
that you received it, or you can wait and get it when you're on site.
Okay. So we're going to acknowledge that we've received it through the link above.
Yep.
Okay. I'm going to go next. And then this is
I wouldn't even
optional.
do that. I would do nothing that's optional.
Yep. So you go next.
Okay. Now here are screening questions. That's the thing. So it's going to ask you questions like, are you currently under the age of 16? It's going to ask you if you're sick. So you have to go through all the questions.
Mm-hmm. Have you had a COVID-19 test because you had symptoms? Have you been treated with antibody therapy or convalescent plasma for COVID-19 in the past 3 months? Have you ever had an immediate allergic reaction to any vaccine injection or shot to any component of the COVID-19 vaccine or severe allergic reaction? These are just some of the questions that you have to continue to answer.
And you have to answer all the questions.
Have you had any vaccines in the past 14 days, including the flu shot? Are you pregnant, considering becoming pregnant? Do you have a bleeding disorder, or are you currently taking a blood thinner? And by the way, up here you can see how close you're getting to the end, because that bar continues to move, and it shows you that we're at 66% on the top there. Do you have cancer, leukemia, HIV, history of autoimmune? Do you take any medications that affect your immune system, such as cortisone, prednisone, or other steroids, anti-cancer drugs, or have you had any radiation treatments? Again, these are all required. Have you ever received a dose of the COVID-19 vaccine?
Okay, Matt, this will be the last question
Okay.
before it gives you your appointment.
Okay, so we're not going to go beyond this point
Right.
because
And you have to
for
redo
Mr.
it.
Doe. But this would be the last one that states that you've read the entire list of priority groups eligible for COVID-19, and that you certify under penalty of law that you're eligible for COVID-19 vaccine, and you agree by clicking and selecting yes. So you would click yes, you would hit next, and then you'd be locked in with your appointment for that date and that time at that site.
Right.
Okay.
And I believe after you do all that, at that time, you could also fill out that COVID-19 form that they want to bring to you.
So let's go, if we can. I think I also wanted to, let's see. So we have the am I eligible?
On the bottom.
Here it is. It's on the bottom. So on the bottom of our page here, you can see this block here. Once you have an appointment prior to receiving the vaccination, you must complete the New York State COVID-19 vaccination form. So you can click on this link and it brings you to that form.
Yep.
There it is. You guys see that? And again, like Lisa said earlier, if you can just roll with number one, that you're 65 or older and reside in New York State, then that's the best option, right, Lisa?
Yes, it'll bring you into the system quickly, and you'll have less questions to answer.
And so again, we would go back through and fill out the first name, last name, date of birth, the zip, all the required fields. And we showed this earlier, but again, this is required to be filled out prior to arriving for your vaccination. And again, if you need it, like I said, like I showed earlier, right on the town's website, on the coronavirus website, located right here on the right side, this link right over here. Okay. Lisa, Noreen, anything more that we want to walk through?
No?
I think you've covered it all.
Okay. Well, again, we wanted to just provide a step-by-step as we continue to receive questions and calls from our constituents. We are, like I said, working diligently with the Department of Health, with other medical providers as well. I was on the phone with Caramount today, and we are working with them. And so it's a team effort. The key word is persistence, as you heard Lisa and Noreen say. There's no, like I said, secret code to get anybody to the front of any line. And so we're going to continue to provide as much information as we can. We are here to help. So if you need assistance, please don't hesitate to call. You can call my office, which is 914-962-5722, extension 200. That's my direct line. Noreen, can you provide the number for the senior center, please? The senior.
Yes. So our number here is 962-7447. Please leave a message. If you don't get an answer, we will return your call. Matt, I would also like to say that the Department of Senior Programs and Services have been a great help to us. May Carpenter and Jean Peachy, they have been wonderful for our seniors. And a senior can also call there if they feel comfortable. Calling there is 813-6400, and they will also help you.
813-6400, and that's a number for our partners at the county level for our senior services. And again, like I said before, it's a true team effort, but we're all here to help, and we're all here to lend a hand. And so if you do need additional assistance, please don't hesitate to contact us. And I know between Noreen and Lisa and the rest of our team, both here at Town Hall and on the county level, we'll do all we can to make this as easy as a process as we possibly can. But like I said, and what Noreen and Lisa said, persistence is key. And we're going to continue to try to find additional ways to assist to those who are in need, who do need it. We are working with the county and with other medical providers to address some of our homebound seniors. That's a great concern of ours as well, obviously, because they can't go get the vaccine. And so we are working diligently to address that issue. We did hear that there were more folks who have been deemed eligible, including our food pantry workers. And so they have now become eligible to get the vaccine as well. And so, again, it all comes down to supply. And as supply grows, there will be more appointments made available. We heard from President Biden that he's hopeful by the end of May at this point that supply is going to be substantial enough that all, I believe he said all adult Americans will be able to receive a shot. So we're very hopeful. Again, patience and persistence, though. That's what it's going to take. And again, know that the town of Yorktown and all of our partners are here to assist in any way that we can. So please do not hesitate to reach out to us. Lisa, anything you want to add here?
And please, even though you're getting your vaccines, please continue to wear your face masks and wash your hands and watch your distance. Face masks should cover the nose and the mouth, since the virus initially lives up in the nose. And if you need anything, reach out to Matt. You can always ask me some questions, and Noreen as well. And stay safe and stay well.
Lisa, thank you so much for joining us. Really, really do appreciate this. Noreen, anything you'd like to add?
No, I would like to give a shout out to the Yorktown families on Facebook, because I have to be honest with you, that is where I have been able to get a lot of seniors through that Facebook. People post the
people
little
share
link.
Information. Yeah. But it also just proves the point. The town doesn't get notified beforehand. So sometimes we're finding out things from other people within the community that we weren't even notified of. So
right.
it does help. And when we talk about, it takes a village, it takes the whole community to help each other. Sharing that information is critical. And again, it also proves the point that the town doesn't get notified beforehand. So just know that we're trying just as much as you all are to try to help as many people as we can. We're committed to it. We're here to help. And we will continue to provide as much information as we can. We do hope this was helpful for, again, any of our seniors and any of our elderly in our community. Please don't hesitate to reach out for help. You're not alone. We're here to help you. So just pick up the phone, 914-962-5722, extension 200. I'll say it a million times. Give us a call here at Town Hall, and we will be more than happy to give you a hand. Until then, Yorktown will provide any additional information as we get it. Stay safe, stay healthy, wear your mask, and we'll talk to you soon. Thanks so much.
Thanks, everybody.
Thank you.